CHECKMATE-069 was also presented at AACR this week, and another exciting trial. I mean, we had phase 1 data about a year ago, combination therapy with ipilimumab, which is approved, and nivolumab, which is approved, but they're not approved in combination. And although the toxicity is a little higher, the results are really spectacular. And I think that's the key word for that, spectacular. You have 61% of people had measurable tumor shrinkage as per the standard RECIST 1.1 criteria. But if you look at the data even further, there's only about 14% of patients who didn't respond who actually had disease grow, and that's unbelievable. I should add that the CheckMate-069 study is a little early. In other words, it's not a huge group of patients, and I'm not sure it's going to be the definitive answer on whether or not you should be giving this combination of drugs. I think we all think, or I think anyway, that ultimately this combination of drugs is going to be the way to go for this group of patients, frontline therapy. But there's a bigger trial that is currently cooking, and we don't have the results yet, and that's CheckMate-067. And that's a randomized comparison of nivolumab alone or ipilimumab alone, and then the third group is the combination therapy. And that's a really nice trial. Double-blind, randomized, placebos in there, and that's going to give us an incredibly robust answer as to whether or not, how good, not whether or not, but how good that combination therapy is relative to either therapy alone. Why is this combination important? As it turns out, when you talk to a patient about immunotherapy, I always say the same thing. If you look at the big picture, there are two things that your immune system needs to do to fight cancer. The first is recognize that's a cancer. That's bad, that's melanoma. And the second is you're swimming around in the bloodstream, you're a T lymphocyte, and you see that melanoma and you say, aha, that's bad and I'm going to kill it. So making the memory and acting on the memory. And the reason it makes so much sense to combine those two drugs is that ipilimumab helps your immune system make the memory, and nivolumab helps your immune system act on the memory. And that's why it's perfect, and it makes great sense.